14% of Americans struggle with food insecurity, which means they don't know where their next meal is coming from, or they've struggled in the recent past to be able to afford the food that they need to put on their table for them and their children.
Not having access to enough nutritious food to lead an active and healthy life. And I think that's really important for our patients because they not only need to have nutritious food to have good healthcare outcomes, but we have patients who have difficulty even just getting any food at all. So having access to appropriate nutritious food is especially hard.
When you're critically ill or chronically ill, it's just that much more of a struggle because you can't get out to shop and cook for yourself. You're not necessarily able to make money, and oftentimes you need something very specific in your diet.
Food is an important aspect for chronic kidney disease to actually prevent the disease and to treat the disease. And we don't often think about the role that food plays in treating and preventing chronic kidney disease. But we have a lot of studies today that show that if you eat well and nutritious foods and avoid certain other foods, then you're less likely to have diabetes and high blood pressure and obesity. And those are all risk factors for chronic kidney disease.
So you have to invest in local foods, in beautiful food, in culturally appropriate food that is then medically tailored. The medically tailored is really, really important, but if it's not appetizing, they're not going to eat it.
We've learned a lot about the importance of a lot of social determinants of health. Having stable housing, having transportation, having access to nutritious food. And I think this food is medicine concept has shown us that those types of interventions can change outcomes a lot.
If we prevent one night in the hospital, we save the system enough money to feed a patient for 6 months. That's a pretty good business argument as well as a healthcare and humanitarian argument.
But we also in the medical literature have research that shows that nutritious and medically appropriate foods slows the progression of chronic kidney disease and can prevent the onset of chronic kidney disease. So we want to bring all of that together to impact all of the people that we're trying to take care of with kidney disease.
It's impossible to not see the tie between food and healthcare, and that there are so many places where it's not even complex, it's intuitive.
And I think that addressing social determinants of health, including using food as medicine, is going to be a very important part of helping to provide excellent quality outcomes coupled with very efficient, cost-controlled, value-based care.